Hi, my name is Steve Eady. I'm with the Sauk Valley Education Voter Forum. That will be happening in a few weeks. With me here is Dan Proft. He's Republican candidate running for governor.
Yes.
And we had a list of 10 questions that he got beforehand. We gave all our candidates questions beforehand, so there was no surprises. I'll start right off. I'm going to talk about the budget. Moody's recently downgraded us from A1 to A2.
Again.
Yeah, other people have downgraded us as well. We are now second worst grade, financial grade in the country, second only to California, and everybody knows about California's issues. We have $11 billion operating deficit. That's 35% of the budget. First question to you, and I guess I'm leading this because most people that we got questions from believe this as well. Do you feel Illinois has a spending problem?
Oh, there's no question that Illinois has a spending problem. That has been fundamental to why Illinois is in the financial predicament it's in. In the last 10 years, adjusted for inflation, general fund spending in this state has increased at 8 times the rate of population growth. And now what do we have to show for all that spending? Better schools, better transportation systems, a more robust job climate? Of course, we have none of those things because the money has gone to finance secure jobs and guaranteed pensions for patronage armies in Chicago and Springfield, who in return for those secure jobs and guaranteed pensions provide the political support that sustain and advance the careers of the Chicago Democrats who run this state. That's the scam. It's just a straight up street hustle. And so people in this state are being fleeced to finance a government that they've received very little back from in terms of either benefits or services, which is why you have to completely rethink state government. All of the big ticket systems where most of our tax dollars are spent, that means K-12, Medicaid, how we invest in transportation infrastructure, our 5 state pension systems, and the tax and spend policies that drive the solubility of them all, they have to be completely overhauled, completely rethought. We are so far past the point of tinkering on the margins, which is why I've called essentially for policy revolution in state government. You have to completely rethink the incentives that these systems provide and the obligations they impose if you want to bring Illinois back from the precipice of economic collapse.
Okay, so you're talking about wholesale change here. I mean, you really want
Yes.
to change. So let's talk about some of those specifics here.
Sure.
Talk about spending. I mean, how do you know where you can start cutting and where you can't? And I'll give you an example. I mean, and I guess this is a question for you. How do you get elected to a position when you tell people we can't spend this money anymore or I can't do this anymore?
Well, you don't try to be all things to all people. Mm-hmm. You say, here are the core missions of state government, and here is a logical way and a fair way to finance them so that state government lives up to its promise to the residents of Illinois. Okay. So, for example, there's a bunch of cuts, one-time cuts that we could do right away. I've identified more than $4 billion worth. Things like $110 million we're spending to buy up land in Peatone for a third airport that's never coming to the Chicago metropolitan area. Right. $400 million for high-speed rail from Chicago to St. Louis, which isn't even high-speed rail. It goes 30 miles an hour faster than Amtrak. We don't have the rail infrastructure, grade crossings, and we have a freight congestion problem in Chicago. I mean, it's just a boondoggle, and that's a down payment on $9 to $12 billion project. That's not something that is a core mission of state government, particularly in these financial times. And I could talk about this over and over and over again, but the reality is that one-time spending cuts is not enough. Politicians' promises to rein in runaway state spending is not enough. The obligations and the costs associated with those core systems of state government need to be completely rethought, completely overhauled. So, for example, Medicaid, which is our largest single general fund expenditure, under Blagojevich, Medicaid was expanded to household incomes up to $86,000 because he was trying to buy off the middle class, essentially. But that's not a universe that Medicaid was ever intended to serve. We need to means test Medicaid back to 200% of poverty level, which is where the program is intended to serve. Low-income seniors, low-income children from low-income households, the developmentally disabled, and pregnant women. I mean, when you take these programs and then you start expanding them, using them to buy political support, that's when you get into situations where we are with Medicaid, where it's growing at 10% per year. It's going to consume half the state's budget in 10 years if we do nothing to fundamentally restructure it, and you just can't make the numbers work. What I say is that everything that's wrong with state government can be summed up in a single word: math. you cannot make the math work. You cannot make the numbers work with what you say these systems are going to do and who you say they're going to serve and the resources we have to provide those services.
Well, let's stay with Medicaid for just a second,
Right.
because one of our questions was about the health care bills that are passed through the Congress and Senate. Now they got to come together and figure out if they can create one bill that they can all agree on.
Right.
Won't some of that force the state of Illinois to continue to do certain things with Medicaid? Because they make promises in Washington, but the state of Illinois ends up paying for a lot of that. As you mentioned, Medicaid is one of the largest, if not the largest part of the state budget. What controls can Illinois have from mandates from Washington?
Well, I think you're going to see a time in this country where not just Illinois, at least if we have the right governor, but governors from a lot of states are going to rediscover the 10th Amendment. And you're going to see states assert states' rights in response to federal power grabs or federal government overreaches. And so I've talked about specific instances where I would invoke our 10th Amendment rights and go to federal district court as needed to push the issue. Unfunded mandates like No Child Left Behind.
Okay.
Impositions like the federal takeover of our health care, which I would seek to opt out of. If there was ever an effort to make gun laws more stringent at the federal level. That those are areas where I would say, wait, you're infringing on states' rights as enshrined in the Constitution, and we're going to push back. We're not just going to sit here and be a pincushion with Illinois already being a donor state to the federal government. In other words, we send more of our money to D.C. than we ever get back, and now we're not going to sit back and just be a pincushion for kind of the socialist utopian ideas of D.C.
Well, you mentioned federal overreaching their power limits and invoking the 10th Amendment. They are probably going to pass some sort of health care in the next year, is my assumption. What are your thoughts on improving the healthcare system, or is there any problem with the healthcare system today?
Well, there are problems with it, of course. I mean, nothing is ideal. The problems really revolve around folks with pre-existing conditions who have trouble getting health insurance. But the other problem, the cost problem with healthcare in this country, has a lot to do with government intervention already into the marketplace. It's not been a lack of government intervention, it's been too much.
Go into detail on that, because I think a lot of people would like to understand that a little bit more.
Well,
Tell us about it's not really a free market is what you're saying.
Right.
What are they doing that are inhibiting free market in healthcare?
Well, price controls is number one, and price controls is an anathema to true free markets. Right. Number two, this is more of a federal issue, but it still highlights the point.
Sure.
You can only buy health care plans in the state in which you reside. So in other words, if there was a health insurance company that provided a different plan that you found more attractive in Indiana, if you live in Illinois, you can't purchase that plan. So there's no competition across state lines.
How can the federal government do that when the Constitution says they're supposed to ensure interstate commerce, yet they're prohibiting interstate commerce? I don't understand that. Is that unconstitutional?
Well, I think you could certainly make the argument that it is.
Okay.
Yeah, and so you've seen a lot of people and Republicans in Congress who've said, if you want to improve the provision of a service, if you want to lower the cost, we know how to do this. It's called create a competitive marketplace. Mm-hmm. So one of the things you would do was allow healthcare plans to compete across state lines. Okay. The focus for Illinois and healthcare, though, really goes back to Medicaid. And one of the things that I've talked about doing, and again, infusing market principles into a system that is command control right now. Right. Take the dollars that we get from the federal government to support our state Medicaid program and seek waivers from the federal government, Independence Plus waivers and HIFA waivers specifically for different Medicaid populations. Take those dollars and set up premium assistance programs whereby you assist low-income Medicaid-eligible Illinoisans to buy health insurance in the private marketplace just like anybody else. But then you give them and you force them to take dominion over their own lives. They have to make healthcare purchases, but then bear the associated costs of those healthcare purchases, so you've connected consumer to provider, which is one of the real problems with Medicaid today. I mean, to analogize in a way that people not familiar with the intricacies of Medicaid can understand, right now Medicaid in Illinois and other states works like this. Everybody goes out to eat at a restaurant. You get the menus, there's no prices on the menus. You order whatever you want, and when the bill comes, it's based on ability to pay. Right. So those with no ability to pay are going to go out to eat every night, and they're going to order whatever they want because who cares? Somebody else is paying for it. And we have this problem replete throughout all the systems in state government where there are no incentives for cost control, there's no incentives for personal responsibility because the politicians have told state dependents, do whatever you want, and will impose those bills on the people who play by the rules in the state who receive very little back from their government.
Well, let's go back to your idea, because I think explaining that a little bit more to people will help them understand what you want to do. So you essentially want to take the money the federal government comes in and essentially privatize an insurance system for
Right.
those people. That's essentially what you want to do.
Right.
Now I'm going to play devil's advocate for a second. Someone will say, well, I've got a pre-existing condition, or I'm not very healthy, and so I have a lot of medical bills. I still can't afford them. What do you say to those people? What